What about your health? Well, we're heading into the busiest period for the NHS, and officials are already warning that it's going to be a really tough flu season with an increase in respiratory conditions and slips and trips. That's expected to put a lot of pressure on services. So today on BBC Radio Cumbria, we are looking at how the NHS in our county is preparing for all of that. Our reporter John Burness is spending the morning at Carlisle Healthcare in the south of the city. Good morning, John.
Yes, good morning to you, Steph. You're right, I'm at Carlisle Healthcare. It's a huge surgery with not just doctors, but all sorts of other healthcare people here as well. It's a really big site. It's not kind of loud and sort of bustling because everything is done in a kind of very measured way. And I'll give you some stats in a moment about just how many people are being seen or are making appointments this morning. But we're not standing beside the main reception where you can kind of hear, doors opening and closing and people walking in and out, because also that's where the names get called for people to go into surgery. And clearly, I don't want to be, broadcasting across the county somebody's name who's coming in as a patient. But I've popped into one of the side rooms to speak to my next guest, who I'll introduce in just a moment. But first of all, just a quick snapshot of some of the appointments that are being made this morning. They've had about 100 contacts, as they put it, an hour so far since 8 this morning. That's sort of new people getting in touch, needing appointments or at least needing advice. So by 10 o'clock, 20 minutes or so ago, there'd been 135 phone calls. There'd been 133 online queries, so that's almost as many, making a total of 268 patient requests. And that's in addition to the appointments that had already been made for today. So that's sort of, additional people needing either an appointment or some advice. And the doctor who leads the site was telling me a few minutes ago, at 10 o'clock, they had 0 calls sitting waiting to be answered. So, he was making the point that it seems to be working successfully in terms of letting people get in touch the way they need to make appointments or ask for advice. Of course, one of the ways that we can all increase our chances of staying healthy through the winter is to try and keep ourselves fit through the year. And that doesn't just mean necessarily regular checkups and trips to the doctors or even medication. And I'm with someone who's going to explain a little bit more about that. Rachel Murdie is described here as being the social prescriber. Rachel, good morning to you. Thank you for coming to see me in here. First of all, it's the obvious question really, but for anyone who's not met it, what is social prescribing? What does it really mean?
It's probably better described as community connector. So it's that role, non-clinical role within general practice where we can get in touch with people and think more widely about their health and well-being, and then link them into third sector and community supports that are there to improve their health and well-being. So it's kind of looking more widely at health, emotional, mental well-being, rather than tablets, prescriptions, things like that.
So the things that you can almost sort of do for yourself and with help from your community, rather than needing to be taking pills.
Absolutely, yeah. So it's trying to think, right, do I need a tablet for that? Or is this something that actually, if I thought about what was happening for me, there might be a better way of addressing that and helping me feel a bit better.
So what kind of things do you offer, or what kind of things do you encourage people to do?
So usually it starts off with a bit of a conversation. So it's getting to know somebody, understanding a little bit about what their circumstances are now. So we all have social circumstances that impact on our health and well-being. And then it's thinking, really teasing out with them, what are the things that you might be interested in doing, what things might help, and then I can maybe go away and have a look around what there is locally that might meet that need, and then we can come back and have further discussion if that's necessary. Some people are quite simple signposting. Other people need a little bit more input and a little bit more sort of coaching, motivation to sort of find their way forward.
So does this tend to be sort of social things or exercise things or both or other things that I've not even thought about?
It can be anything and everything. So it's whatever somebody comes up with, which sets me a challenge every day. So it can be health and fitness, it can be arts and crafts, it can be cooking, it can be walking groups, it can be social groups like activities, quite often now gaming, which sets me a bit of a challenge because that's something I know very little about. So everything and anything really, it's what's important to that person.
Because on the face of it, you'd think anyone doing a lot of gaming involves kind of sitting on your backside in front of a screen. But I suppose these days it's a social connection with other gamers, isn't it?
It is. And now there's more places in the city where you can actually go and do that sort of role-playing gaming together more collaboratively. But, it's also thinking about if that's what they're interested in, that's maybe the hook to then them thinking about, and what else could I be doing? So, is this good for me, sat in my room gaming 24 hours? Or is there something else I could be doing that might improve my social circle? So
I'm just wondering how people react in general when they're sort of steered towards social prescribing. Often people who come to a doctor's surgery expect a magic pill, or at least a pill of some sort, or some medicine to either take away their pain or to help with whatever's wrong with them. Are people sometimes sort of reluctant to engage with social prescribing because it very much takes effort from yourself, doesn't it?
It does, and it's a real cultural shift. So it's a cultural shift for the NHS services to think about these type of roles, but it also is for the patient, because it has always been quite transactional. You come in, you say, this is what's wrong with me, somebody fixes me. And that's not what we're doing. It's more, like you say, engagement and motivation from the individual.
And is that kind of difficult to convince people about, or do most people really embrace it? You're smiling at this point.
It can be, but I mean, we can all be confronted with that. Change is difficult. So, and actually addressing that, I might not be helping myself is a difficult thing to acknowledge. So it does take a bit of support to get through that.
Okay. If people do get involved in these programmes, we're talking a lot this morning about winter pressures in general. How much can social prescribing help them with, winter time, the added ailments that brings for many people, or how much, are they still going to need conventional medicine?
Yeah, I mean, it's going to go hand in hand. So it's not an either or. It is a hand in hand sort of model. And winter pressures, Christmas can be a really tricky time for some people. Dark nights, all those things, maybe confidence to go out in the evenings and stuff to groups and activities. So it is difficult. What I would say to people is look at your local community centres. They offer warm hubs in the winter. They offer advice and guidance. Quite often have organisations going in delivering talks and information. Also pop-up pantries, but, and sometimes just a warm, smiling face. Lots of Christmas activities that you can get engaged with if you wish to.
And a warm, smiling face can make all the difference, really, can't it, in many cases? Just to finish with, and just kind of turning all this around for a moment, and I did warn you I was going to ask you this, but if you could do some social prescribing sort of on yourself, as it were, for yourself, of all the things you've been mentioning, or of all the things that you invite people to do, which bit would you like the most yourself if it was you doing it?
I think for me, it's kind of the yoga relaxation, kind of, gentle exercise and just building my own resilience, because sometimes dealing with a lot of other people's issues can be quite tiring. So sometimes it's just about acknowledging we all need to build our resilience at times. So.
OK, that sounds a great answer to me. Thank you very much. Rachel Murdie, who's the social prescriber here. Thank you for all of that. Steph, I was just saying earlier with Mike Zedder at breakfast that I'm a man in his, I have to admit now, late 50s, who feels that I could probably do with losing a couple of pounds. So I'm going to finish for now, hand back to you, and check out any of the social prescribing options that Rachel might be able to suggest for me. And I can imagine that's going to start with taking more walks, but I'll find out in a moment.
Fantastic, John. We'll check back in with John very soon. John Burness there at Carlisle Healthcare. So we will be catching up with John throughout the morning as well, as part of our special day focusing on the NHS and looking at how ready the NHS is in Cumbria for winter. Right, it's BBC.